नहीं हो गया शुरू। मैं शुरू करा दूं, बस 10 मिनट 15 मिनट लगेंगे, बाद में ले 2 मिनट हो गए। हेलो हेलो प्रश्मित,
सर गुड मॉर्निंग।
गुड मॉर्निंग। गुड मॉर्निंग। आवाज आ रही है मेरी?
हाँ सर आवाज आ रही है आपकी।
चलो अभी बाकी लोग बैरी आ गए।
बैरी सर आ गए क्या? बाकियों को ज्वाइन करने बोलता हूँ सर मैं।
कर ज्वाइन कर लिया मैंने।
उनको ज्वाइन कर लेना सर, बाकियों को ज्वाइन करवाता हूँ मैं।
करो।
अरे यार ओके। हाँ 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 गया काम थोड़ा।
Good morning, everyone.
Good morning, guys. It's Dr. Piyush here. Can you hear me? Hello. Hello, Dr. Barry. Can you hear me?
Yes, I can hear you loud and clear.
Thank you. So I'll just give you basic what you need to do on this Zoom. Basic instruction to all the participants, and then I'll be streaming it live. Then I'll quit the chat. No issues with that. So I think she's not here right now. So Dr. Mrinali will be hosting the event. Okay?
What is the order of events for today's talk?
So that I think Prashmit will tell us, because I'm just helping them out.
Okay, awesome.
Sir good morning.
Good morning.
Hope you are fine sir.
I'm very good, thank you.
So sir, as you know, we have organized this webinar and you are the speaker. You are the first speaker. Then ma'am will speak. Ma'am, are you there, ma'am? Hello.
Hello.
Yes, ma'am. Can you hear me, ma'am?
Prasmit?
Yes, sir.
You're getting a lot of feedback on your audio. Are you moving around?
No, sir. I'm not moving around. I'm settled on one place. Is it fine now?
That's better, thank you.
Okay, sir. So, ma'am, can you hear me?
Hello.
Hello?
Yes,
ma'am,
yes.
Okay. So, with the blessings of you both and Piyush and sir, we are going to start the session soon. So, hope this session will be one of the best session ever. So, sir, as you know, I have first instructed you that you have to use PPTs without photos of, as you know, all the rules and regulations of YouTube, right, sir?
Yes, I do know. There are
Okay,
no
so
pictures of people.
yes, sir, yes, sir. That's it. Piyush and sir, anything else to inform sir and ma'am?
Okay, so just nothing to be informed like that. So the order is Dr. Mrinali will open the event, start the event, and then Dr. Barry will present his lecture. So what will be the timing for your lectures? Means how much time you going to take?
I'm not sure. I would say round about between 25 and 30 minutes.
Okay, that's it. Okay, so what we're gonna do is like we're gonna pre-announce the timings so that if somebody want to ask question, they are prepared with the questions. So the questions will be taken from YouTube as well as our personal chats, and we will give those questions to Dr. Minali, and she will ask you the question. So moderator will be asking you the question if there are any. Okay, and so you will be presenting a PPT, right, sir?
Yes.
So the Dr. Minali will be the host for the event, so she will make you co-host. and you will get all the privileges of sharing your screen and presenting the PPT. Okay, sir?
I was about to ask, I need you guys to open my share screen option.
Yeah, so we will open that. We will make you co-host at the time of your lectures.
Okay, excellent.
So, yeah. So after that, once your lecture is over, again Dr. Minali will take over, and then she will introduce Sucheta ma'am, and then she gonna take her lecture, and that's it. This is
Yes.
how.
Okay.
Okay. So
Yes, yes.
okay, and please be in contact with this Prashmit on your WhatsApp or whatever medium, so that if something goes wrong from your side or our side, maybe the network, because there is a warning of cyclone in Maharashtra today. So if something goes wrong, at least we'll be able to convey it to the public. Okay.
Confirmed?
I'm saying that actually there is a warning of a cyclone in India today. Okay, so if something goes wrong, like maybe the network from your end or our end, at least we'll be able to communicate it with people. So be in touch with Prashmit on phone or whatever medium you have, except Zoom.
Excellent.
Okay, sir. Any other thing you want to ask, you can ask me, sir.
No, I'm ready.
Okay, perfect. So I think there are still 20 minutes left. So Dr. Minali, I'll just tell everything to Dr. Minali, and then you can unmute your mic and you can come. Okay. Hi, good morning, Minali. Hello. Minali, can you hear me?
Mrunalini sir is talking with you.
Yes, everything's
Piyush
good.
Jain sir, yes, and Barry Getz sir. They are saying hi to you. Are they audible to you?
I just want to change my background quickly.
Yes, yes.
Hmm. Is PhysioPanda the group that has been set up?
No, so actually that is my personal, this is my YouTube channel,
Ah, okay. Why Panda?
and it's my nickname.
Are you okay? I'll remember that. Why are you soft and cuddly?
No comments about that. Okay, Mrinali, can you hear us? But we can't hear you. You are not audible. No issues. Take your time. Okay. Except Dr. Barry, Dr. Mrinali, and Sucheta ma'am, everybody mute your mics. Thank you. Rashmit, how many people will join in Zoom today? Very nice. Mrinali, can you hear me?
Yes, more than 350, I think. Yes, Mrunalini? Yes, you are not audible, Mrunalini. Not audible. Mrunalini, can you hear us? Hello, sir.
Hello, how are you?
Hope I am fine, sir. Thank you. What about you?
Very good. Just very
Yes.
busy at the office with patients.
Yes. So, what are your timings, sir? Office timings?
I'm going to be speaking for 2.5 hours.
Okay.
No, I'm joking. 25
Oh.
minutes to 30 minutes.
20 to 30 minutes is no. What I was asking you was, what are your office timings?
Oh, I usually start
Ah,
at 8 o'clock in the morning and end at about
yeah.
5 p.m. But
Okay.
in this pandemic, we have actually opened our room 7 days a week.
Mm-hmm.
So we work
Right.
whenever we are required to work. So weekends we're working.
Oh,
So last night
yes.
I was on a conference call until about midnight.
Oh. So hectic schedule.
Ah,
Having
it's the new
yes.
world.
Yes, new world. Yes. Brunalini, can you hear us?
No, ma'am, she can't hear. Ma'am, she can hear you,
Yes.
but
She is on call, I
no,
think so.
she's on call with me only. So we are trying to just clarify her voice. So we can't hear.
Okay.
We're not able to hear.
Okay.
Minali, just unmute your
Oh,
mic first. Mic is mute. Just try to speak. No.
Would you like us to do a trial run from the screen share perspective
Sure.
before we start?
Just a sec, sir. I'll make you admin. Others, Minali, we can't hear you. Do something. Okay. So how we gonna go is, nahi, Minali, we can't hear you. Okay, just 2 seconds, Jack, but to try kar. So Chita ma'am, I'm making you mute. Okay. So
yes.
drill is we will make everybody mute.
Yes.
Just a sec. Yeah. So it's all mute. Barry sir, you are also mute. Okay. So let me introduce our guest, Dr. Barry Getz. So he'll be presenting his presentation on what is the future of physiotherapy after COVID. So I would like to welcome Dr. Barry, and I'll be making him a co-host. So whatever I'll do, I'll instruct. Okay, you are a co-host now, and I will unmute his mic and mute my mic, and I'll request Barry sir to share his screen and please start his PPT. So once his PPT starts, I'll unmute him and I'll mute myself. Sir, can't you? Yes, please.
Would you like me to test?
Yeah, please test once. Perfect.
Is that nice and clear?
Yes, sir. Perfect, sir.
Excellent.
Okay, now you can exit if you want. Okay, perfect. So, sir, ma'am, the person who will be speaking will come on the picture, right? So it's like if you have any question while you are speaking, you can write it in the chat box to the person, or if you want, only Mrinali will come in front. Mrinali, you're ready with your mic? We're waiting for you, ma'am. You are also presenting a PPT, ma'am. So, Chitra, ma'am, you are also presenting.
Hello.
Ma'am, you are also.
Yes, sir. Yes.
So, ma'am,
My
can you
PPT is there. Yes, I can share.
just a second? Let me make you co-host
Yes.
first.
Yes.
Now we will mute Barry, sir. Yes, we will mute Rajiv. Ma'am, try to unmute yourself. Because you are co-host, you can unmute yourself.
Mm-hmm.
Okay, perfect. So I'm muting Murnali. Murnali, just speak once. No, we can't hear you. Do something because we have only 11 minutes left. Okay, muting Murnali. Ma'am, can you share your screen once?
Yes. Share the screen. Sir, it is disabled. Participant screen sharing.
Ma'am, you are co-host, ma'am. Which from which you are doing? Which Sucheta's iPhone or Sucheta?
Yes. No. By Sucheta's iPhone.
Ma'am, that is you are a co-host. You can unmute. You can share also. Ma'am, you are using two IDs together.
Yeah.
So which I make
Due to
both.
some problem.
You want me to co-host to both of the IDs or one ID?
Both.
Okay, I think you are presenting
Both
with
on.
you are presenting with another ID and you are speaking with one ID.
Yes. I will be sharing screen by a laptop.
Okay, no issue.
Yeah.
So
So this is my screen.
perfect.
What I have shared. Yes.
Perfect, ma'am.
Yeah. Thank you.
Who said perfect?
Prashmit, I think so.
Okay, don't unmute yourself without the permission of the host, because what will happen? Your picture will come in front with the PPT, not the presenters. Okay, so ma'am, good. So what we have to do is like make sure when you are presenting this to tell the host to make you and the second profile of yours the co-host, both of them co-host.
Okay, both of yes.
If one is co-host, then you will not be, only the screen will be shared and you will not be seen.
Audible, it will not be audible. Yes. I will do that. Yes.
Once you are co-host, you can mute yourself and you can unmute yourself. So once you hand over the mic, just mute yourself. Okay.
Yes. Right. Thank you, sir.
Prashmit, okay, ma'am. Prashmit,
Yes, sir.
ये क्या नाम है आपका? ये आवाज का क्या हुआ?
किसके सर?
अरे प्रेजेंटर बेटा, प्रेजेंट होस्ट.
मृणालिनी मैम, शी इज रीस्टार्टिंग आई थिंक सो. उन्होंने लैपटॉप रीस्टार्ट किया है. ग्रुप में मैसेज आया है सर उनका.
हाँ ठीक.
हाँ. Hope everyone has joined. Yes. Okay.
Sucheta ma'am, can you just stop your screen sharing? You have to stop it from your end.
सर बैरी सर का करके देखा क्या एक बार? स्क्रीन शेयरिंग हो रहा है क्या?
हो रहा है. Perfect. Barry sir is perfect.
Okay, perfect.
So प्रश्मित तेरे को बोल रहा हूँ मैं सिर्फ, ठीक है, कि सुचेता मैम के दो आईडी को हमने कोहोस्ट बनाया है, बैरी सर को कोहोस्ट बनाया है, मैं होस्ट से हट के अब जो भी तुम में से तेरे को भी मैं कोहोस्ट बना रहा हूँ, ठीक है. अभी हो क्या गया कि जितने बाकी लोग हैं ना, they can't unmute him themselves. Only the co-host can unmute themselves. Make sure कि only one person is unmuted one time.
Okay.
So right now you, Barry sir and me are three people are unmuted. Make sure जिसका भी बात हो रही है one person is unmuted. ठीक है? क्योंकि जो म्यूट अनम्यूट होगा वही बात करेगा. There are 8 minutes left. So let me know when you need to start.
काउंटडाउन स्टार्ट हो गया है.
अपना वीडियो बंद कर.
हाँ सर. ओके.
Hello.
Yes, you're audible now.
Yes.
Okay.
So, you know the drill, Mrinali, kaise karna hai?
Yes, you will begin this. Then you will hand it over to me,
We'll
Barry
start.
sir.
We'll start. I'll tell you
Yeah.
what I'm doing. I'm making you host.
Yeah.
You are host now. Make me co-host back.
Yes.
Okay. So this I'll do again. First, you have to make me host because I have to stream it also. So can you see any options at the down page? नीचे 3 dot आ रहे हैं.
The main screen, yes.
Yes. Just click on those dots. Tell me what are the options. Can you see the last option? Live stream on the streaming something.
Live on custom live streaming service.
Perfect. ठीक है. Okay. Now you're host. I am co-host. So don't worry about me. I'll be muting my mic, and once I'll tell you, Mrinali, we are ready to go in 1, 2, 3. Then you can start your presentation. You will introduce Dr. Barry and Dr. Sucheta, ma'am. Okay.
Sorry, can I interrupt for a moment?
Please.
How long have we got till we go live?
So around 4 minutes.
Okay, I'll be back in 2.
Okay. Okay. So Mrinali, इधर हाँ. तो कैसे करना है तेरे को कि you introduce Barry sir and ma'am, ठीक है? उसके बाद you will ask Dr. Barry that sir you're already I have made already them they are co-host, okay? So they can share the screen.
So I just have to mute and unmute.
Yes, you have to mute everyone. Make sure nobody is muted, unmuted, including you while he is talking.
Yes.
लेकिन हो क्या जैसे प्रश्मित कभी कभी अनम्यूट हो जाते हैं, काफी लोग हैं जो अपने आप अनम्यूट होते हैं, तो अनम्यूट नहीं होने देना.
Okay.
देन ओनली उसके प्रेजेंटेशन में बैरी की शक्ल दिखेगी उधर.
Yes.
ठीक है. वंस बैरी इज डन, यू हैव टू लिख ले कहीं पे कि उसको थैंक्स बोल के म्यूट करना है. और उसके बाद उसके को-होस्ट छीनना है.
Okay.
मोर पे जाकर उसके नाम के आगे तो उधर लिखना विड्रॉ को-होस्ट परमिशन सो दैट ही कांट शेयर एनीथिंग एल्स अगेन. इफ ही वांट्स टू देन मेक हिम को-होस्ट अगेन.
Okay.
ठीक है. अगर
Yes.
बाई चांस तेरा नेटवर्क का इशू होता है तो जाने से पहले कुछ भी गड़बड़ होती है मुझे होस्ट बना के जाना.
ठीक है.
So that I can handle everything.
ठीक है. The moment my net starts becoming slower, I'll make you host.
If by chance. अब जैसे देख प्रश्मित ने अपने आप को अनम्यूट किया था अभी. देखा तूने? ये नहीं होना है बीच में.
Yes.
ठीक है. Make sure of that. Okay. So तेरे को समझ आ गई बात?
Yep.
तुझे कुछ पूछना है? अच्छा.
नहीं.
सुचेता मैम के 2 आईडीज ऑनलाइन है, दोनों को होस्ट
तो उनके टाइम पे दोनों अनम्यूट करना है.
दोनों नहीं, एक अनम्यूट करना है, दूसरा तो सिर्फ प्रेजेंट करेगा, वो अपने आप कर लेंगे.
But right now you said कि जो unmute होगा only that person is gonna be visible. तो फिर उनका screen कैसे show होगा?
दोनों होस्ट है ना, स्क्रीन सबका शो होता है, जो अनम्यूट वाला होता है वो बोल सकता है. अब ये तो एक बार मेरे को उस पे चेक करना पड़ेगा. करें एक बार चेक YouTube पे.
Yes.
एक बार एक काम कर, मुझे होस्ट बनाओ. सुचिता मैम आप हो क्या उधर?
Yes, sir, I am there.
मैम एक बार स्क्रीन शेयर करो प्लीज.
हाँ.
I'll mute myself. Huh?
You mute everyone except me.
Yes.
Just a second. Let me connect it to YouTube to see because now you are using 2 ID, so we have no idea about 2 IDs. We know about 1 ID. So let us see what happens. Ma'am, can you start speaking something?
Yes. Hello, everybody. Very good morning.
Keep on speaking. Keep on speaking.
Yes. So today we are going to present a webinar on immunity and how to improve it. And due to this pandemic condition, everybody is in stressful condition.
You need to start your video also.
Video, this screen will be shared afterwards. First, I will share the screen because I have to talk before sharing the screen. So first I will speak something and then I will share the screen.
Okay, perfect. Mrinali, you will handle everything, no?
Yes, but we were trying if she is visible, no?
Yeah, but the problem, I'm saying that she will speak before, because again the two IDs will be a problem. So try to unmute both IDs. So we'll see how it works. Because right now we don't have time because it's already 11 now. Ma'am, you can stop unsharing. Stop sharing.
Yes.
Uh, I have already started the stream. It is not live. So I will start live whenever you're ready. So I'm making you host first.
Yes.
All the best. You are host now. Okay, and make me co-host once.
Yeah.
Yep. So mute everyone except me once.
Just a second.
Okay, perfect. So when I'll say we are going live in 1, 2, 3, by that time, जैसे मैं खत्म करूँगा, I will mute myself and you're ready to go. Okay. Perfect.
Okay, I have selected for everyone. I have selected the setting that no one can unmute themselves. Okay.
Then you have to handle everything. But the co-host can unmute themselves. Okay.
Yes.
So make sure no co-host who is not speaking should not unmute themselves. Okay. So you need to spotlight your video first. You know that, ना? जो कल किया था हमने. Because Zoom पे अभी दोनों लोग आ रहे हैं. You will
Now?
very. Just give me 20 seconds. Okay.
ठीक है अभी?
अभी मैं आ रहा हूँ क्योंकि मैं बोल रहा हूँ. तो जब फोन कर मुझे एक बार.
Piyush sir? Hello? He's mute. Good morning, everyone, and welcome to this webinar. My name is Mrinalini Shukla, and I'm your host for today. I would like to introduce all my organizing team, myself, Mrinalini Shukla, Prashmit Kataria, Aslan Budgyar, Geet Gogari, Rajiv Gavit, Wasim Sheikh. We all have been aware of how physiotherapy is proving effective through this pandemic. But to know more about it today, we have two outstanding speakers, Dr. Barry Getz, an international speaker from South Africa, who at the time is working very actively through this pandemic. He's a partner in private practice at Leisure, Speedley, Davidson and Partners, and has branches at Centers for Sports Medicine and Orthopedics in Rosebank, JHB, and at Linksfield Orthopedics, Sports and Rehab Centers, Linksfield Clinic. With his dedication to this field as clinical physiotherapist for 20 years, he has been affiliated with treatment and rehabilitation of numerous local and international sports athletes and teams. His main focus is lumbo-pelvis hip complex and lower limb injuries with special interest in hip, groin, knee, and Achilles tendon. He is an active member of over 7 associations, for which he is accredited as the Sports Physiotherapist, current South African Sports Medicine Association Region Chairman for Central Area. Our second speaker is Dr. Sucheta Golhar, ma'am, with an immense clinical experience of 29 years and a teaching experience of 22 years, and is currently the principal of Modern College of Physiotherapy, Pune. She is an active board member in IAP Maharashtra chapter and holds over 7 publications for outstanding researches. Along with academics, she is an active social worker as well. She has conducted numerous physiotherapy camps, built a physiotherapy center for tribal area in Kinvat, and working under the famous NAM Foundation. She has also been awarded the PhysioRatna Award, Best Speaker, Best Academician Award at AIIMS New Delhi, the Lifetime Achievement Award at International Conference in Visakhapatnam, and very recently was awarded with the Best Physiotherapist in India Award by Star Time Media New Delhi. It is an absolute honor to be listening to you both today. This webinar will be of 2 parts. Firstly, Dr. Barry Getz will be educating us about private physiotherapy practice and COVID-19 and its future, after which he will be addressing all your questions. So participants, you can post all your doubts in the live chat below. Followed by the second part, Dr. Sucheta Golhar, ma'am, covering the immunity aspect through this pandemic. I hope all of you are safe. Stay tuned. I request Dr. Barry Getz to please commence the lecture.
Good morning, everyone. It's wonderful to address you today. Thank you very much for that wonderful introduction. As introduced, I'm a physiotherapist in private practice. I consider myself a clinician and then a researcher, so I like to apply more of my field of physiotherapy to what we're doing than to sit in the background and actually do a lot more research. But I do a lot of research in that regard. So what we're going to try and address today is where are we as a physiotherapy practice, especially in South Africa, and how has COVID-19 affected us? So to begin, what I want to do is let's highlight a few of the topics we're going to go through. So I'll talk a bit about the actual SARS-CoV-2 virus and how it's transmitted with its lifespan. And then I'm going to move a bit into how I've set up my practice, how we implement or intervene with patients, the type of PPE equipment we use and why we use it. And hopefully we're going to start moving on more into how we care for our actual staff and our patients, and then address the future of physiotherapy. But for that, I welcome all of your input. I would like to answer a lot of your questions. These are very uncertain times, and the literature changes daily, not even weekly, but daily. So you really have to keep your finger on the pulse to understand where this entire realm of coronavirus is moving and how we have to adapt our practices continuously. A quick disclaimer regarding this talk. So by no means is this talk going to be exhaustive on the available topic. I'm not a virologist or an epidemiologist. I'm a physiotherapist. Most of the information should be accurate as of yesterday, and I welcome all your input. Remember, we are all learning continuously on how everything works. Let's begin from the very beginning. So what is coronavirus? So we know coronavirus is a large family of viruses, It's a group of RNA viruses. They were initially discovered in the 1930s within the chicken population. So newborn chickens were born, and they were born and developed these acute respiratory infections. And so we discovered it from there. But conversely, we discovered the coronavirus in humans in the early 1960s, and that was discovered via the common cold, which we know today as rhinoviruses or adenoviruses. We know there are multiple strains of the coronavirus, most of which circulate both amongst the animal kingdom, such as in pigs, camels, bats, even the cat population could be in the pangolin, and so the list is gradually growing. So the coronavirus is a large, round, spherical particle with bulbous surface projections, and we can see that on the first two images. That's on the left and in the middle. The virus is enveloped, and it has a positive sense single-strand RNA genome and a nucleocapsid and helical symmetry. So it's quite a complicated way of saying it's a double enveloped virus with these protein projections sticking out. So those protein projections that stick out are characteristics or club-shaped spikes. So when we view it under an electron microscope, these projections create the image, which is remnants of the solar corona. So they get their name as the crown virus or a wreath virus. So coronaviruses are responsible for mild to moderate diseases, specifically the upper respiratory tract, that range from mild to absolutely lethal. The common group of coronaviruses, we see it yearly with our common colds as it comes through, and they've got numerous names, and we're going to go through that. So let's look at the history, how it's progressed throughout the world. So we initially saw in November 2002 the emergence of SARS, as we know it, also known as SARS-CoV or SARS coronavirus. And we call that the severe acute respiratory syndrome, and it was thought to be an animal virus from an uncertain animal reservoir. We thought maybe it was bats, or so the literature tells us. And then it spread amongst the animal populace into civet cats, and then had a spillover effect into the human population, and was first identified in the Guangdong province in southern China in 2002. So that SARS-CoV resulted in disease called, as I said, called the severe acute respiratory syndrome, so nicknamed SARS, and then it disappeared around about 2004. We then saw a re-emergence of the whole coronavirus in September 2012 in Saudi Arabia, and that was identified as MERS, or the Middle East Respiratory Syndrome. And that caused an illness or a strain of that coronavirus, which became quite deadly almost. But that one was specifically transmitted from an animal reservoir, and we saw that coming from camels. And it continued to spread sporadically, and we're still seeing local outbreaks that are happening throughout that geographic zone. But what's interesting to know with the MERS outbreak, people specifically exhibited symptoms of fever, coughing, and shortness of breath. And what is alarming, especially from my side, 3 to 4 people out of every 10 patients who had MERS died with this virus. So that was quite a lethal version of the coronavirus that was in the human population. We then saw the third novel coronavirus emerge in Wuhan, China. And that was first reported on 31 December 2019. And it was reported as a strange new pneumonia that had a massive outbreak. So it was initially called the 2019 new coronavirus, or 2019 nCoV. And around about 11 of Feb 2020, it was renamed as the SARS-CoV-2 virus, or the severe acute respiratory syndrome coronavirus version 2, as it was found to be a genetic cousin to the initial SARS-CoV in 2002. But later on, it was declared a global pandemic by the World Health Organization, and that was on the 11th of March this year. So why do we have so many names for these different viruses? Well, the World Health Organization, in collaboration with 2 other organizations, which is the World Organization for Animal Health and the Food and Agricultural Organization of the United Nations decided to rename this virus. And we renamed it so it doesn't refer to a specific geographic location, a specific animal, or a specific subset of people, as we don't want to be derogatory in any way. So now we have got the official name as SARS-CoV-2, or its nickname as COVID-19. So to understand where we were, this whole scenario started as an outbreak in Wuhan, China. So what is an outbreak? An outbreak is a sudden occurrence of something that is unwelcome, such as a disease. From there, the outbreak moved into an epidemic, which is a larger version of an outbreak, but that became a widespread occurrence of an infectious disease in that community over a specific period of time. By 2020, it moved into a pandemic status. In other words, that outbreak shifted globally, and that was prevalent throughout the world. What do we know about the transmission of this virus? Well, SARS-CoV-2 or COVID-19 mainly spreads person to person. So the majority of the time, it is via direct contact, and that is either a respiratory droplet or sloughing of your respiratory cells when we cough. And that usually happens when the viral load is very high in that sick person, and it induces an irritation of your respiratory airway to force you to cough or sneeze, and that will aerolize your saliva or those sloughed cells that have a high viral load. We know that it can extend anywhere from 1.5 to 2 meters when we cough, and those infected droplets are then taken into another person, either from being inhaled or swallowed, or they will settle on a surface. We'll touch that surface and bring that in contact with our eyes, nose, and mouth, so it goes to the mucous membrane to be introduced into a new host where it can replicate itself and then continue its life cycle. We often talk about, if you're looking at infective rates, we talk about R0, which is our mathematical term to identify the contagious nature of an infectious disease, or it's also known as its reproductive number. So if you look on the right of your screen, if we have someone who has an R0 of 18, it means that person is able to transmit that virus to 18 other people in one go. And that is highly, highly infective. So in 1918, when we saw a world outbreak of swine flu that killed 50 million people, that R0 value of swine flu was 1.4 to 2.8. And that's, we don't regard that as very high, but that is an uncontrolled pandemic that swept through the entire population of the world. So if we look later on at the swine flu in 2009, also known as the H1N1 virus, it only had an R0 value of 1.4 to 1.6. And vaccines and all of those antiviral drugs then made its way in about 2009 to help reduce that infective rate. If we look at the seasonal flu, it's also got a fairly low value of 1.1 to 2.3, but this is all much lower than things like measles or rubella. And when we refer to a high transmission rate, what we really want to understand is what is the transmission rate of COVID-19, and that is between 2 and 2.5. So that is much higher than our average seasonal flu. And that's what scares us, is the infective rate moves logarithmically almost through the general populace. And that's why we've had such stringent means to stop transmission through social distancing and washing our hands repeatedly. We know that the median or the average number of the COVID-19 is about 5.7. So on average, COVID-19 transmits itself to just under 6 people. So if you are in close contact with people, we see a massive transmission rate. And you'll read in the literature things about herd immunity and how do we pick up immunity. And immunity is specifically seen in a large group of people is when we build up an immunity, a natural immunity, and hopefully that will start depleting the spread of the virus so the virus becomes inactive, or we have to develop a vaccine, which we're very far from according to the literature. If we look at its lifespan on how long this virus can last, outside of the body. So we talk about titer studies that scientists are doing. So they will swab an area and they will look at the concentration once they dilute that swab in a medium to see how long it will actually last, how active or how positive are those viral cells on that medium. So a nice little summary on the left, we can see that on paper or toilet paper, it can last about 3 hours from the studies. Moving down, copper's a good 4 hours, cardboard 24 hours, and we move all the way down. And what's interesting to know, if you look at your typical 3-ply surgical mask, can last up to 7 days on that mask. So we'll talk about hygiene of wearing a mask as well. And it's important not to be touching the outside of that mask or touching a multiple variety of surfaces, even like a glass where we drink our water from, where it can last up to 4 days there. So that's pretty alarming in that regard. And in some cases, if we're talking about people just touching various surfaces like plastics, we've got a good 2 to 3 days of that virus there. When we want to interrupt the virus, we've got quite a few studies, and a lot of these studies actually began with COVID-1, which was the original SARS virus and MERS virus. And we started extrapolating data from that literature to give us an idea of what actually happens with the SARS-CoV-2 virus and how long it's going to last in that surface. But more importantly, what interventions do we have to halt that virus? So we start talking about surface disinfectants, like a 0.1% solution of sodium hypochlorite, or an ethanol or alcohol solution that's between 62 and 71%. And for all of you saying, well, how do we get hold of those concentrations? Very simply, go to the World Health Organization website, and they have specifically detailed how you prepare those solutions, especially when you're working in your private practices. Ultimately, purchasing these solutions is very costly, and in a diminished economic environment, it's important that we have these readily available for hand washing and also disinfecting the multitude of different surfaces. So let's start with these different interruption processes that we talk about, the typical washing of our hands or sterilizing areas, because we've seen this all on the news about people going through the roads and spraying an entire area, or just talking about simple hand hygiene. So soap and water, we need to know that you have to wash your hands for at least 20 seconds. And that becomes a highly effective way to defend against this harmful virus that we've got. But not only viruses, bacteria. So good hand hygiene is effective. And I'll go into greater detail as to how this all works. If we look at alcohol and how does it actually work, well, I use about a 70% solution in our office, and that's a broad spectrum good germicide and antiviral. And we look at using that as often as we can, not just between patients, but even during a treatment, especially if we're moving around that patient. But what the problem with alcohol is when we use it for prolonged periods, it actually can create discoloration on a surface. Regarding our hands, you can get a local dermatitis, you can get hardening and cracking of those various surfaces. And so ideally, alcohol for some people is a hassle, but it's a quick version of a quick disinfectant, because we can get a good antiviral protection for, I would say, in about 1 to 2 minutes. Other things are things like bleach, which has a very strong disinfecting property. And if we dilute our household bleach, we can actually kill that virus, and it will take about 10 to 60 minutes for that to actually reduce any contact times that we have. However, if we use bleach on ourselves, it does irritate our mucous membranes, and it can also increase the skin in our airways. So again, we've got to look at that, and also bleach is highly reactive with other chemicals. Looking at the top right picture of your screen, we talk about using chlorine dioxide gas. We use that at a very low concentration, which is 0.1 parts per million. And that's very effective against viruses, especially influenza A. So it's not just the COVID-19 virus, but another spectrum of there. However, if we breathe in chlorine dioxide gas, we can create severe lung irritation. So when you have an exposure within your own practice, you might have to defog that room with chlorine dioxide, but that room has to be evacuated and sealed for a minimum of 3 hours. And we actually are recommending closing that room for a full day and then allowing good ventilation thereafter, as we don't want to have an onset of pulmonary edema of the staff or patients. Moving into the bottom right corner, we talk about UV robots to disinfect areas, and these are primarily available within a hospital setting. They're very expensive, and they can't be carted around to different surfaces because they do get damaged. But we can see disinfection occurring within 2 to 3 minutes. However, if we leave it within an area, we can actually create a massive skin irritation or even damage to your eyes. So enough about what we have. How does it actually work against COVID-19? So as I said, the COVID-19 is part of the corona family, and we see it because of those spike-like proteins that extend off the membrane of that virus. And we know the virus loves to transcribe its RNA into host cells, so it will use those spike-like proteins to attach to another host or a person that it's just infected. But we don't interrupt when using these different methods on that spike protein. We're more interested in the weak area of this virus, which is the membrane. And what we know about that membrane is made up of a lipid structure. So we're going to try and attack that lipid structure to damage the internal RNA components of this membrane or render it inert. So talking about simple soap and water hand washing is for me, the most amazing tool. So what is a soap molecule? So a soap molecule chemically has 2 distinct parts. It has a hydrophilic head or a water-loving head, and it has a hydrophobic tail or a water-hating tail. So the hydrophilic head, when we mix the soap and water, the hydrophilic head, which is again that water-loving, will attract those water molecules together, but it will leave that hydrophobic tail available. So when it comes into contact with that hydrophobic tail will then interrupt that membrane, and it will eventually break those lipid molecules to break open that cell. And that's what we can see in that second picture. Then what will happen is, as those RNA components leak out, the hydrophilic or the water-loving components will then encase that virus molecule and render it inert. So then when we've washed our hands, we are literally washing that virus down the drain. And that will go into our central water system, and over a few days will be rendered inert and die because it hasn't leached onto a host cell to transcribe its RNA. And that's why we say it is a wonderful tool. So that little Michel, that the water-loving component encases, hopefully moves down the drain. So it is important, again, once we've done that, before you even touch your face or touch food, you still have to wash your hands thoroughly so you don't introduce anything onto your face. So that is the basic idea of how soap and water works. If we talk about hand sanitizer, most of our hand sanitizers contain ethanol or isopropanol or N-propanol, and these 3 alcohols are highly effective in that lipid-wrapped virus, like the novel coronavirus. So what it also does is it works by preventing the proteins of those microbes from leaching on anywhere. But it's very important that you have the right percentage of alcohol. If your alcohol content is too low, it won't affect that lipid membrane. If it is too high, all it does is it burns the virus or sears it. And then later on, that burnt part aspect will just peel off, and the virus will then become active again. If we look at things like chlorine dioxide, what that actually does, it denatures those protein spikes. So it doesn't attack that cell wall. If we look at UV radiation, it's quite a fancy process. It works on photochemical modification, and it breaks that cross-linkaging in cells, or it has an oxidative damage. to the cell or a photodimeric lesion to that area to render that virus inactive. But moving forward, enough of the virology. We are physiotherapists. We need to identify what is this virus. So we see common symptoms, and common symptoms have gradually increased over the past few weeks or months. So it wasn't just a fever, cough, and shortness of breath, but we now see that extending much more into things like fatigue of the patient, rigors or tremors or chills that they feel, headaches, sore throats, and we see loss of smell or taste or diarrhea. So when we talk about screening of patients, we'll be talking a lot about the different symptoms. But what's important to note is this virus, as itself, it can lead to a pneumonia or a respiratory attack, which can lead to septic shock or death. So we don't see people dying of COVID-19, but rather dying of other ailments that it predisposes you towards. So often we now see in our patients almost getting what we call a cytokine storm. In other words, this virus triggers an autoimmune response, and your blood gets flooded with proteins called cytokinins, and that lands up causing tissue damage or damage to our organs. So it's important just to note, not just looking for those symptoms, but if your patient has things like trouble breathing or shortness of breath, even chest pain or pressure on their chest, do they have a new confusion? They're almost getting an anoxia from the condition, or they can't wake up fully. Do they get bluish lips or a bluish face? And that can all lead to things like strokes, and then we've got to look for our stroke signs, which is very important. So if you see that in any of your patients in your rooms, that is a medical emergency. That needs to be reported immediately. And if that patient doesn't have a mask, you need to put a mask on that patient absolutely yesterday, so you don't spread the virus from there. So if we look at China and their data, 99% of people with COVID-19 reported having a fever. So it's a very good symptom to look at. 70% of them reported fatigue. 59% of them had a cough. 40% of that populace had a lack of appetite. 35% had body aches or reported body aches. 31% only reported shortness of breath. And then the production of your mucus and the phlegm only really occurred in 27%. And so fever has always been one of our chief criteria that we look at, hence the reason why we continually are taking temperatures of patients. If we move into our private practice setting, there's a lot to regard. So I've just tried to highlight. So in your office environment, be that in a government facility or a private facility, I work primarily in private rooms. So we've got separate buildings to hospitals. We've got to look at a multitude of different things. So not only do we have to screen staff and patients, but we've got to educate them. And then we've got to protect everyone whilst they're in our offices. And we've also got to look at the legal implications of having people there and what the government demands of us to ensure a happy place to work that we can continue working. So let's start with, I'm going to talk you through about me and my private practice, what happens when a patient sees me. So ultimately, we always start with screening. And screening starts when the patient has booked that appointment. So our receptionist or our person who mans the telephone is our primary source of screening. They have to actually ask that patient from the very beginning is, excuse me, sir or madam, do you have any flu-like symptoms, such as a fever, coughing, shortness of breath, a sore throat, loss of smell or taste, nausea or diarrhea? If they reply yes to that, they get referred to a physiotherapist. In other words, they'll refer the call to me, they'll take down the number, and I will phone that patient back a bit later so we can perform a more detailed screening. We ideally don't want to let any of these people into our rooms, otherwise we have broken our infection control of the rooms and we're putting everyone else at risk. Thereafter, the patient, if they've cleared of those questions and they arrive for their appointment, just before they enter the facility, we're going to screen them again. And it's a mandatory screening. So if our patients say, I don't want to be screened, we don't let them into the rooms. And we do a lot of different things. So we do things like surveillance forms, And it's quite a little detailed form in the bottom right corner of your screen. That's what we have, that's what we're doing, and we kind of comply with what our hospitals are doing. And that big form is not necessarily to stop our patient coming in, but it's also an epidemiologic form. So it's a surveillance form. So if we do find a positive case, we can go back in our database of patients that have been treated and actually look where they were. So we can look at our contact lists, and our epidemiologist can then say, all right, guys, you were all here on such and such a day at such and such a time. All of you are now compelled to undergo a voluntary isolation period, with later on doing some sort of COVID testing. So we can then render you either positive and know how long to isolate you for, or whether we can admit you back into our general population. So some of the things that we are now doing is, over and above that screening, we have an online system that we use. And I've taken a few pictures. This is me before I even enter our rooms. I'm online on my phone, and we enter this, so we're starting to capture this all digitally. So what are we looking for? First thing we're looking for is, we're asking the patients, well, are you working while you're visiting in the rooms? Because if you're a worker, you actually are a higher risk than a visitor. You are seeing patients on a day-to-day basis, and we need to know that. And then I want to know, are you a healthcare worker or just a receptionist? Then moving on, we want to know, have you been in contact with other COVID-19 patients? Now, if you are a worker and you have been, we have to undergo further screening. And that's moving you into a triage section. But if it's a patient and they say, yes, I have been in contact with a COVID-19 person, I don't admit them into my rooms. If I do need to treat them, I'm going to see them in complete isolation in a private room, and that will change my PPE gear that I'd wear with that patient. Whereas with your almost non-infected general contact patient, my PPE gear should change accordingly. And PPE gear is expensive, so we need to understand that. We will then ask the patient, have you visited a retirement home in the last 7 days, or do you reside in a retirement home? In South Africa, retirement homes have become hotspots. So ideally, I don't want that patient to enter into my main area when all my other therapists are there, or my other patients. I would rather see them in isolation. So we'll see them after hours, where we can control our environment in a bit more detail. We also ask them, do you have a face mask to wear in our facility? If they don't have one, we have to make sure one is available for them. The idea of wearing a face mask is to stop the transmission from that patient to us. It doesn't stop us giving it to the patient. So that's pretty important. We'll also ask them other things like, have you lost your sense of smell or taste? Do you have diarrhea? Do you have a sore throat or a cough? And all of that is just to help us provide or weed through our more infective patients versus our non-infective patients. So if we do yield a patient who is a potential high risk, we also have to understand, well, what are the comorbidities in our screening? Because these are high risk patients, and this spills over onto our staff. So patients with high blood pressure, heart or lung disease, asthma, kidney disease, especially people who have dialysis. Do they have obesity, diabetes? Are they undergoing chemotherapy for cancer? Are they a smoker for cigarettes? Do they have liver disease? All of these are factors that put them in a much higher risk category. And quite frankly, if I've got patients with that, I'm trying to isolate them more in my practice. So if they're coming in, I'm ensuring no one is in our waiting room at that time. I'm rushing them quickly into a private room where we control across infections to other people. Also, our elderly are people who are most likely to get sick, people who work in nursing homes or in long-term care facilities. So bear that in mind. And when we talk about children, children are also a high-risk category. And these children who are developing COVID are getting something called a multi-system inflammatory syndrome, which is further complicating it. And this is very simple to things like toxic shock or Kawasaki disease. So that all entails just our screening of patients. And we haven't even spoken to our patients or laid a hand on them for the condition that they're actually coming to us for. Now the patient has arrived and they're entering our facility. So now what do we do? So before they even work in or walk into our rooms, we're doing sanitization. So we have contact sanitization stations where they can sanitize their hands. We have a lot of notices that they've got to read. We instruct them that masks have to be worn at all times in our facility. They're not allowed to take off their mask. Not only that, we ensure that not only do we have sanitization bottles everywhere, but all our bathrooms have soap and water and disposable paper to wipe your hands and throw away. So we're really performing a massive education role on our patients before they've even come in. And we're providing them with the ability to sanitize as well. So looking into what do we have to do in our office before the patient walks in, we still have to socially distance everything. So our regular chairs that we have lined up, they've got to be positioned at least 1.5 to 2 meters apart. So if patients are waiting for that appointment, they are not in close contact. If they're waiting to talk to the receptionist, if you look at the second picture, we are putting markers on our floor to socially distance them as well. So those demarcated lines are very important. The third picture, we're putting up screens to our reception staff. Our reception staff are coming into contact with every patient, just like us. So we want a physical barrier, almost like a face shield, to guard up our reception staff. So aerolized saliva or infective cell from our respiratory system can't pass on to them. And again, notices are paramount and they must be visibly noticed by the patient. But this means you're still not ready to treat your patient, even though you've got all of this in play. It is super important, especially in South Africa, and this is moving worldwide, that we start making what we call a COVID-19 ready plan. So this is a written guideline that we have in our office. And this is almost coming through from in South Africa, from our Department of Labor, and I urge everyone from around the world to have this. So what does this actually mean, this ready plan? This is a detailed scenario. You can't always be available. So if you've got employees or staff members, they can pick up this manual and it will tell you exactly how far chairs should be spaced apart. What are our demarcated lines? How often should we be sanitizing our hands? What do we do on a day-to-day basis before we start treating patients? Are we disinfecting every chair, every examination bed, all of our equipments? Yes, we are. So I get to work a good half an hour to an hour before everyone else, where we start wiping down our surfaces. Then I'm wearing gloves, an apron, I'm wearing a facial mask, maybe even a facial shield, and we're disinfecting our workplace before we start. And we've got to have the appropriate bins, our red bins, for contaminated products that are there. Then, and only then, we then have to detail what is acceptable patient behavior. Are patients allowed to shake hands? Are we allowed to hug each other? The answer is no. So that starts from that idea, and we want everyone to be on the same page. So if there is unacceptable behavior that's happening, we can immediately say, I'm terribly sorry, when you are in this facility, we do not allow contact between patients. There is no shaking of the hands. Cough hygiene has to be appropriate, and we will get into that in detail. And then most importantly, what if we have a positive COVID-19 case that we're in contact with? What is our procedure that we are going to follow? That we don't have to now run around and say, well, what do we do? Where do we go? We all know exactly what is happening. And that's what a COVID-19 ready plan is. So we're all on the same page. So that's very similar to working in an emergency room and performing triage. We all know what everyone else is doing. So our patient has now arrived at our rooms. So in the bottom picture on the left, that is the entry to my rooms. So what I've got is 2 sanitization stations. One is a foot operated pedal, and the other one, the patients just put their hand on and it will release the sanitization. But again, I don't know if you can see it. I've now got notices that are over here, and there are still notices at our front door, which is in front of us, which will then tell them our exact criteria or warning signs in entering our rooms. Once they move into our office, I've got a red line on the floor. That tells them they are not allowed to approach our desk. We also have our facial shields that are intact, so our patients can see where not to go. We have spaced our chairs appropriately so patients can wait away from other people. If we look in our treatment area now, we are a sports practice, so we're primarily treating musculoskeletal conditions. We do not treat respiratory ailments in our facility. We don't have the ventilation for it. So our treatment stations are positioned 2 meters apart. In that dark recess, I haven't turned the lights on there yet, we've got 4 private rooms where we can treat our patients. But at all times, we have to protect not only staff, but also the patients visiting us. And we've got to bear that in mind. And then we have appropriate disposable areas where we put everything. If we look at our protective equipment, now this is a big contentious issue. How much is enough? Are we going into full PPE gear for every patient? I personally don't think that is the case, because all that's happening is that virus is going to settle on the outside of our work suits or our PPE gear, and now it's going to be passed from patient to patient. So we need to identify what is the appropriate PPE gear to work with. So before, on my side, what do I wear on a day-to-day basis? I'm now working in surgical scrubs, not because I feel it's more sterile. It's just my regular clothing is getting damaged from the repeated alcohol use that I'm using, and I'm almost bleaching my own clothing. But also, having surgical scrubs means that when I arrive in the office with my regular clothing, I can then put all my clothes in a sealed bag. I can then, in another bag, take out a fresh set of surgical scrubs, put that on, and now I've got clean clothes to go home in when I've finished my day. At the end of the day, I will doff my surgical scrubs appropriately. I'll turn it inside out. It goes into a non-sterile bag for washing. And then I'll put on my clean clothes. So at least when I get back into my household with the rest of my family members, I'm being a bit more cautious as to how much COVID I've got on my body. That clothing will then come off immediately as I get home. It goes straight into a washing machine where I can wash my clothes at a high temperature, and I have a good shower, and now I'm ready to greet my family. I'm bald, so I don't have any hair on my head. So yes, I do have to wipe my head before I come home, but you can wear scenarios just to protect you, especially ladies who have got long hair. You need to keep that out the way. So it's very important to tie your hair and work from that position. I wear a 3-ply surgical mask. I'm not using an N95 respirator. I am not in a truly high aerolized environment where I need to use an N95 mask. I certainly am not using a cloth mask. I don't believe that they offer enough protection for those smaller particles that we see if a patient does cough. And my surgical mask remains on the entire day. I don't take it off. If it comes off, it goes immediately into a disposable bin. So if I'm going to have lunch, I've got to doff all my PPE gear again. I can have lunch, and then I've got to re-sterilize and get dressed and continue. I do not wear gloves in my practice because I sterilize my hands before a patient, during a treatment, and after a treatment as well. If I happen to work in a hospital, if I need to see a post-operative patient, we have different areas within our hospital that declare different levels of PPE gear. So most of it is in our green zone that doesn't require gloves, but if we're moving into a yellow, which is our person under investigation area, we still have to wear aprons and gloves. And if we're moving into a full COVID-19 ward, we will don a full medical kit, as if you see it on that bottom right corner. So not only am I wearing a 3-ply surgical mask, my surgical scrubs, I wear an apron when I'm treating. I'm not wearing a full apron. I actually have my arms fully exposed. So when I wash my hands, I wash all the way up to my elbows, as if we're going into a theater for a proper surgical scrub, and I'll use soap and water. That is between patients, and then I will use my alcohol sanitization whilst I'm with the patient. I will wear goggles as well to protect my eyes, to stop the splash. I used to wear a mask. I'm now wearing goggles. I will talk a bit about that because it's quite controversial what we wear. So if we talk about goggles and mask, ideally you should be wearing both, and our next slide will cover that. You should ideally cover your shoes because the floor is probably your dirtiest area in your practice, and you are going to be moving that COVID-19 virus around. So it's pretty important the shoes you wear, you want to keep quite clean. So when you're at the office, have almost like a surgical pair of shoes that you want to wear. And when you leave to get in your car, those shoes shouldn't go with you. They should be in a sterile bag, and you should be spraying down your shoes thereafter. If we talk about the goggles versus the face shield, so goggles, it protects us from splashes, sprays, and respiratory droplets. But the problem is it doesn't protect the rest of your face. So those droplets can settle on your cheek. And if you're not familiar with surgical masks, those goggles often fog up, so you do have to have a good anti-fog coating on them. What's great about a face shield is it gives you a much bigger barrier to the rest of your face. However, when you have smaller particles that are getting aerolized, they come in from the side and can quite easily settle in your eyes. So you need a pair of goggles and a face shield. And if you look at the disadvantages of a face shield, you have that peripheral lack of protection, whereas your goggles have side protection, which is quite great in that regard. So just to get a bit technical, if we look at droplet diameter, most droplets that when we cough are about 8.5 microns or micrometers. And the shield is really good at protecting that, but it will reduce your exposure by about 96% when you're sitting at about 45 centimeters from the patient. But the moment the patient starts repeatedly coughing, or other patients are coughing, you can get other types of droplets being formed. And these are more in the region of 3.4 micrometers. So those are much smaller, and those sit in the air for a bit longer. So a face shield, its effectivity reduces down to about 68%. And we can just go on and on about all of this, but at the end of the day, if you really want to be protective, a pair of facial goggles and a face shield is the way I would recommend, especially if you are a respiratory therapist. And then you've got to have an N95 mask, a well-ventilated area with all your PPE gear donned before you even treat the patient. But that is a calculated risk that each of us need to make when we treat our patients. But as I say, I'm primarily in a musculoskeletal environment. I treat primarily lumbar spines, pelvic injuries, and lower limb. So I am within a half meter of my patient. So I wear the goggles, a facial mask, and an apron with good hand hygiene. But it's also important to know, especially here in South Africa, and this changes when you're in India, not only do we have COVID-19 to contend with, but now it's allergy season in our environment, and we're seeing things like colds and flus. So it becomes a bit more tricky as we see a lot of overlap of the variety of different conditions. So COVID-19, almost all the symptoms can be present, but if we look at a simple cold, shortness of breath is not common. But shortness of breath in a highly infected patient could be common. Whereas if we look at allergies, it's common to have a stuffy or a runny nose, but it doesn't mean that we now need to panic and report every case. You need to understand that a lot of these symptoms that the patient will experience should occur in unison with each other. So it's a fever in concurrency with a runny nose or a sore throat. But bear in mind, there are other aspects that we actually are looking at, so it can be a bit confusing at times. If we look at our recovery rate with COVID-19, what's nice is we're seeing a good 97 to 99.75% recovery rate. So we're looking at between a 1 to 2% highly infective or serious rate of this virus in the populace. We don't have an immunity for it yet. We haven't developed that natural immunity or herd immunity, and there is no vaccine available. If you look globally, these stats were taken yesterday. So unfortunately, we're looking at 6 million people worldwide with deaths of 371,000. That equates to about a 6% death rate. So that's pretty alarming. But if we go one step beyond that and we look at India and South Africa, we're actually doing relatively well. So in India, as of yesterday in the morning, you had a confirmed little under 200,000 positive cases. And from a death rate, so you're looking at about a 2.8% risk rating of this virus. And that kind of fits in almost the predictive world stats that we're seeing. South Africa, we're sitting at about 2.2%, but we've just come out of a lockdown, a 5-week lockdown, and so we haven't even started to see the increase of our curve yet, or the peak velocity. So that should slowly start picking up as the weeks advance from here. So we'll see a gradual increase in that. So now we've had all the bad news and we running around and we don't know how to protect ourselves or how we can protect ourselves to see patients. It's important we know, well, what are our preventions? So washing, covering our nose and mouth for coughing is important. And these are all widely available. Please go and look at the World Health Organization or your National Institutes of Communicable Diseases. They have a lot of these little tips available. So we want you to wash your hands regularly. So definitely washing your hands before you eat or before you touch your mask is important. If you do touch your face or touch your mask, wash your hands again so you can protect others. And if you think you've washed your hands enough, wash your hands again, especially if you're unsure. It's quite important to practice social distancing. And this extends not only to patients, but also in your social behavior. So you don't want to bring this home to your family. It's important, yet you maintain specific social distances if you are unsure what's happening. Avoid touching your eyes, your nose, and your mouth, especially the front of your mask, repeatedly throughout the day. Be conscious of it. Make a concerted effort not to do that. As I said, clean and disinfect your surfaces always. You never know what is sitting on a surface. And it's very easy to touch those surfaces and then come back and touch ourselves. If we're looking at our patients and our staff, make sure your workplace is clean and hygienic. And that's your desks and your tables where we all sit. Telephones, even things like money that is transferring. If you're handling money, it's important you wash your hands afterwards. Credit card machines, they should be disinfected between patients. So we've got a lot of spray bottles that are available that people are constantly spraying down surfaces just to try and decrease the contamination of surfaces, to decrease employees or as your staff or your customer contact. So it's important to have many hand sanitizing bottles all over the place. And you want to display as many posters as you can so people understand how to appropriately wash their hands and what not to touch. So we know soap and water is a good option, but we need running water and soap then in a facility and good access to that. We also want to promote good respiratory hygiene. So if the patient's going to cough, have tissues available for them to cough into. That tissue will then need to be disposed, or they cough into a bent elbow, so the virus will go into their arm, but hopefully they're wearing a mask, so whenever they cough, it will be on the inside of their mask and it will not be transmitted to anyone else. It's also important to know is if anyone is experiencing symptoms, rather stay at home. You don't need to come to the office and be a die-hard medical member of society, especially if you've got a low-grade fever. It's important you monitor symptoms like that. And also remember certain drugs, such as your acetaminophen, your ibuprofens, your aspirins, those can hide some of your symptoms of the infection. So it's important to note if anyone is on that. But posters are crucial in this regard with good communication. Let everyone understand what is appropriate. But understand that your patients, they are seeing warning signs wherever they go. And they are very fearful. And they don't understand, if I come to your offices, am I going to contract this virus? Hopefully, we all have excellent hygiene practices at our offices. So coming to our office is actually a bit safer than going into a supermarket for shopping. But remember, the public has got a lot of fear. There's been a lot of media going out there and news flashes and social talks about people dying. So it's important to almost maintain a calm environment for your patients when they arrive. So let's talk a bit about how you can maintain your clientele. So now we can treat them, and we're all capable of treating them, and we've all taken the appropriate measures to protect ourselves and protect our patients. Let's talk about how we maintain our clients. So we've effectively managed their condition, but there's still that innate fear about COVID-19. So communication is super important for our patients. So timely and effective communication should be a priority for them. Don't wait for them to ask the questions. Offer a lot more information to them in this period. It's a great idea to send out electronic communications to your patients so they understand. That's what I do. Before a patient arrives, they will get a WhatsApp message from us that will tell them exactly, these are the procedures to follow when entering our rooms. This is our expectations of you. Keep it short and sharp so they understand. Long messages are often missed by patients. Maintain a positive attitude when your patients are there. You're an independent professional and you carry a lot of responsibility. So as stressed as we are, and as the patient, they are overwhelmed. So you being positive and exuding your energy and your confidence puts them at ease so you can do an effective work treatment. And if you're enthusiastic and you have a good zeal or an attractive personality, those people will enjoy being with you and they would want to come back because we are doing everything in our capacity to protect them. It's important to acknowledge your client as an individual. They're coming in not only with this fear, but you also want to maintain this relationship with the person. And if they can acknowledge your professional nature, they will acknowledge you as the professional and listen, and that goes a long way. Just remember, so even if a patient walks in, it's not, have you washed your hands? Have you coughed in a tissue? Remember, they are still a person. Ask about, how are you guys doing? How's your family keeping? How are those children that you've got? How's school going? Are you doing good schooling with them? Are they self-educating now? Or are they attending? Just keeping it at a more personal level does help. It's important to share your knowledge. Understand that as a medical community or fraternity, we have this knowledge that is innately there. We understand all these technical terms. The patient does not. So take your knowledge. Don't try and be complicated and talk above them, but rather bring it down to a very simplistic level that they understand. Sharing that information is paramount, and it instills a confidence from the patient into you. And that's pretty important. I've noticed that quite a bit. I'm doing a lot more educational sessions with my patients before I'm even treating them, especially on how to wear a mask, how to wash your hands, what is appropriate behavior when going to a grocery store, and bringing external items back into your house. So patients are really appreciating a lot of this information that we're giving them. Don't be scared to give an open opinion. That's why we're there. That builds a strong and lasting relationship with patients and ultimately will lead to trust. And that helps you in your treatment, because the patient becomes far more agreeable and they will avoid that uncomfortable confrontation. So that's pretty important in that way. Also, exceed the expectations of your patients. It's a great way to build a strong relationship as an independent practitioner, and that will result in exceptional results being delivered. So not only do you want to do an excellent treatment, but you want to tell them, please listen, what I would love you to do, the reason I'm giving you a lot more exercise than I usually do is I would like you not to come into the practice as often as you usually do, to decrease your contact time that may be available in society. And that's what I mean by exceed expectations. Also remember, there are alternative ways to consult with your clients. You can use telehealth or video conference means. It does go a long way. Sometimes it's a good way to follow up with exercise. And also know that it has limitations. If you can't manually assess a patient, you will have to say, we have reached the extent that a telehealth consultation can achieve. We now need to do a face-to-face consultation. Don't be afraid to do a face-to-face consultation, but also know there are other avenues that we treat. However, and this comes with a big warning, that opens us up to, as medical people, to other avenues of medico-legal problems. So please bear in mind, not only should you have a consent to treat letter for face-to-face consultations, you should have a consent to treat or dispense advice for telehealth medicines. And that's pretty important. And then don't forget, follow up with a call with your patient. If you've seen them and it's 2 days later and you're not busy, pop them a quick message asking them, how are they doing? Are you coping with the exercises? How do you feel? How is your pain values? If the patient's being reported or being referred to you, send a report back to that doctor more than you would usually do. Maintain open channels of communication. That is what makes you successful as a physiotherapist. It's how you are going to keep your clientele coming back to you, especially in this suppressed economic environment. So what is our role as physiotherapists? Well, I've always had my own definition of what a physio is, and I've always said we are concerned with the assessment, the diagnosis, the treatment, the education, and preventions of human movement disorders, pain, and disability that may arise from injury, trauma, or disease. So that's quite a long definition, but as physiotherapists around the world, we have got, or we are positioned excellently, not only to manually treat a patient, but also to educate them. And that's a massive role for us. So look at the bigger picture. If you don't have clients because they're too scared or apprehensive to come in, your role immediately shifts into that of education of your community, which is fantastic. A lot of our clients or our patients are now working from home. So you can do ergonomic guideline care for them. And then that leads them to not having all these weird and wonderful overuse injuries. People aren't exercising outside as much as they once did. They are exercising at home, and that will lead to a whole host of new conditions. So you can set out preventative causes whilst training at home. So that's how we look at our community needs, not just on how we manually treat, but hopefully we can expand more on this topic with all of the questions that you guys have. I was asked before this talk, well, what about academic pursuits during this time? If we're not busy, how can we as physiotherapists advance our academics? So yes, you can move on to master's or even PhD level. It's a great time to actually start your research process while you've got time. But also it's a good time to start reading all these new research or published reports that are out there, not relying on secondhand information in the media. Really get down and look for good level 1 evidence for how you can treat certain conditions. And that's how I would look at your academic pursuits. Or like we're doing now, start online platforms where we're discussing different topics so we can expand our knowledge. And with that, I say thank you, stay safe, and I look forward to a lot more of your questions as they are coming up. So over to the organizers.
Thank you so much, sir. This was certainly a very, very informative lecture. Most of us were only aware of how precautions should be taken by covering your hands and your mouth, but the detailed information about maintaining all the measures in the clinics, or as you said, the PPEs, were very informative. Many questions have been coming, and most of them were certainly cleared already in your lecture. But there are a few questions that I would please.
Okay, well, I've got the questions here, so let's go through them one by one. So the first question I've got is, What are the later complications of coronavirus? So we don't know. So the complications of COVID-19 or SARS-CoV-2 is you get all the concomitant infections. That could be your pneumonias, your pneumonitis, it could be joint aches or pains, but we're seeing a very good recovery rate. I said between 97 and 99%. So 1 to 2% of people will be severely affected by this virus. The others will go on to have a healthy recovery, but we use supportive care whilst they have this infection. I hope that answers the question, but we are literally just supporting that infective stage until our immune system actually gets rid of it or fights it off. Next question is, after complete recovery, is there a chance to exacerbate? So this is a very debatable question. The idea is can we get a second bout of infection of COVID-19? And the answer is, I don't know. So we don't know if we're getting 4 to 5 months of immunity and then we can get reinfected. We do see with our common cold, our rhinoviruses, our adenoviruses, this happens to us year on year. We keep getting colds. So chances are, yes, we can probably get reinfected, but I actually don't know. We're still waiting to see what's happening at this stage. So third question is, as you have knowledge about the symptoms and its effect on the body, how does this impact on the musculoskeletal system? Again, very good question. So if someone has, if they're pyrexic, they have a temperature, we know that your body is going to be painful. But a lot of the times when a patient is COVID-19 positive, they're getting intermittent symptoms. In other words, they feel fine for 2-3 hours, and then for the next 20 minutes, they feel terrible. They feel fatigued, they feel short of breath, they're getting tremors or rigors in their body. And so we don't know. But quite frankly, from my point of view, we're going to treat this almost like we have influenza or the common cold. It's important to have good nutrition, good fluid intake, and good rest. So I don't see a lot of musculoskeletal problems arising because of COVID-19. On the contrary, what I'm seeing, because of people being in a lockdown environment where our government has said you're not allowed to go out, I'm seeing a lot more overuse injuries from people training in their backyards or training in their studies and doing a specific injury over and over. And that would be your tendinopathy-based injuries or explosive plyometric type injuries, but those are normal musculoskeletal injuries with any type of treatment. Moving on to point 4, if a person is infected with coronavirus, what is the immediate role a physiotherapist will be doing? So for me, it would be education. The patient is going to be worried, they're going to be panicked, they don't know where to go or what to do. So it's very important that you calm that patient down. You say, all right, this is where we are. You've got COVID-19. It's part of the corona family, and these are the symptoms to expect. Now, in South Africa, we've got a very specific guideline. It's a reportable condition. So our Center for Disease Control wants to know about it, so it does need to be reported. And usually we refer them on to a doctor who does a lot more of the background work, where they have to set up a contact list for the patient, and you've got to start notifying everyone who's been in contact with that infected person. That's how we're going to try and control a local outbreak. So our role as physiotherapists is to facilitate that patient onto the doctor to do a lot of this work. We are not trained epidemiologists. They need to move on to our epidemiologists to help in that regard. I hope that handles that. We are not doctors, we are physiotherapists. So when I say we are not doctors, we are not medical doctors. That falls within the realm of medical or medicine. Question 5. Is a CT, is it helpful for a primary investigation? I'm not sure if I understand that question. I just have the word CT. It can be helpful for primary investigation. I'm not sure of what. I'm going to need clarification on that question. If it is a CT scan, in other words, we're talking radiology, I think you're talking more on the lungs. Now we're moving more into the the medical condition. So a lot of the times the doctors will diagnose the condition and they might say, listen, we've got a pneumonitis, not a true pneumonia developing. We need to start respiratory care on our patients. In other words, we might be putting them on oxygen therapy. We might want to start our normal respiratory chest physiotherapy that we're doing. I'm not a respiratory therapist, but usually we get referred those conditions. So that would be more of a doctor's role to tell us what is happening with the patient, and then we need to discuss what we need to do. Question 6. According to Italian doctor, an autopsy states that it is not a virus but a bacteria. So we'd like to acknowledge us about this context. From what I've heard and what I've read, that is complete nonsense, actually. SARS-CoV-2 is a virus, not a bacteria. If it was a bacteria, we would be treating our patient with antibiotics, and we would be treating with broad spectrum or very local specific antibiotics. A virus will lead into an immune compromisation, which may lead them to a secondary bacterial infection that has developed. So we are treating our patients symptomatically or as they present. So they now get infected by a virus, and if they become immune compromised, yes, we may need to then talk about antibiotics, but that is again from a medical standpoint, not from a physiotherapy standpoint. So yes, they probably did find some bacteria in autopsies, but I think that is secondary to the underlying virus. That's my opinion. I can be corrected, but that is my full understanding. So next question is, why does India have a mortality rate that has a good recovery rate as compared to other nations? Well, the first thing I do is, well done, India. Excellent. That's what we want to see. I want to see there being an excellent recovery rate. So we're seeing a 1 to 2% mortality rate, and that means India is fitting well within our expectations or our predictions. South Africa is seeing the same, but I think with India being the second highest population in the world, you guys have really done an expert job. And I think a lot of that is for compliance. Does that mean government is telling you what to do and you are complying? Hopefully, yes. Hopefully, you've got excellent guidelines. South Africa, unfortunately, we don't have such good compliance. We've got a lot of highly dense, packed squatter camps where people are transmitting this virus, creating hotspots. I personally think our figures are underreported. I think we've got a much higher infected rate. But bear in mind, one can only know how big your infection rate is based on the number of tests that are performed. So the more available tests that there are, the higher your infection rate should be. But then we're going to see a good recovery rate. Bearing in mind the way I have just spoken about this being a virus, we're going to see this virus gradually moving through our population and affecting 1 to 2% severely that populace. And then they're going to have a recovery rate. We don't know. I'm not a doctor, I'm a physiotherapist, but I just think India maybe is being really brilliant on their social distancing and their hygiene principles. So kudos to India. I think that is excellent, and I like to hear that. Question 8. Initially, viruses affected people who had underlying diseases. Later, it affected healthy individuals. So what is the reason behind that? Well, what unfortunately we're seeing is the virus is affecting people who don't have comorbidities, like the common cold. I can't say why. All we know is people with comorbidities are more prone to getting this viral infection. So healthy individuals, yes, are getting it, and we're getting this via close contact or direct contact. So touching a surface, touching our face. So we don't know. So I would hope that healthy individuals who do get this recover quickly, and even people who have the comorbidities, that's the heart, lung, liver disease, cancer patients, patients who are on dialysis, can bounce back from this with good secondary care that we're giving them, or supportive care. That's more of a medical question. I actually, unfortunately, can't answer that. So let's move on. Question 9, as a virus can stay dormant in the body due to various interactions, could it be possible to change its strand and re-emerge showing different symptoms? Yes, it actually can. So it's evident when we saw COVID-1, the SARS in 2002, then we saw MERS later kind of popping up in 2014. Now it's 2020 and we've got COVID-19 or SARS-CoV-2. We've seen genetic mutations occur. We're watching them come up. I don't know if the virus can remain dormant in the body. Remember, a virus is RNA based in this case. It is highly reliant on infecting other cells so it can replicate itself. Is it going to almost act like TB? No, it's not going to act like TB. If it doesn't have a chance to replicate itself and stay active, it will die down. But that is a case that our immunologists should answer, or our specialist physicians. I'm going to watch the literature very carefully on that. It is something that does worry me about the re-emergence of new strands or new mutations. But as we're seeing hotspots emerge, we watch our doctors carefully looking at that and then screening our patients, taking samples and looking at, is it the same coronavirus or has it mutated? The next question that I've got is, does heat kill coronavirus? Well, I've read that if you sit outside and you get 2 to 3 hours of direct sunlight, it does kill it, but not if it's in your body. That's on the surface of an area. So if you have clothes, for example, and you've got coronavirus or COVID-19 virus on your clothes and you're outside for a good 2 to 3 hours, yes, you're getting UV irradiation on your clothes, so it could do it. But it doesn't mean that you're in a humid, hot environment that it would kill that virus. I don't think I would rely on that scenario to kill a virus. I would rather look at decreasing social contact, good hand hygiene, good respiratory care about cough techniques, and rather rely on that measure than rather just looking at heat alone for COVID. Just remember, we have UV robots sterilizing areas, and that's where it is killing the virus, not really the heat created. But we do talk about washing your clothes in high temperatures of 60 to 90 degrees, ironing clothing to cause almost that denaturation of proteins. I think in combination with everything, it's a good idea. Next question I've got is, what kind of breathing exercises will help patients to wean off from a ventilator? As I said, I'm not a respiratory physiotherapist. So if that patient's on a ventilator, you're talking about CPAP now, continue positive airway pressures, or you're going to reduce the CPAP and you're going to have little stimulators or triggers to help with the CPAP. Usually a patient that's ventilated, we keep them partially sedated because it is very uncomfortable. I would rather revert in saying, I'm not up to date with that knowledge. I'd rather you speak to our ICU doctors and our respiratory physio. So the breathing exercises is not really my field. So unfortunately, I'm going to bow out of that question. Next question, what kind of breathing exercises can help to wean off from a ventilator? I've just answered that, so I'm bowing out from that. Hopefully someone else can provide better insight. And I don't see any more questions coming through. So with that, I'm going to mute myself and we're going to pass on. So Dr. Sucheta can take over and then I'll be available afterwards for more questions. So thank you everyone, and it was wonderful talking to you.
Thank you so much, sir, for clearing all these questions and my personal questions, which I'm going anonymous for. Now, I would really like Dr. Sucheta Golhar, ma'am, to take over this and tell us more about immunity and what else can you do to maintain this immunity. So,
Thank you very much, Dr. Mrunalini. And thanks a lot to Dr. Barry Getz, sir, for giving a very informative and valuable session. So this is very good, knowledgeable for our students and all the participants. Thank you so much, sir. Now, before sharing all the slides, I will like to talk something about immunity. Now, today's topic is how to improve immunity. Now, today, in day-to-day life, everyone is busy in work and have hectic schedule, lot of worries and tensions, which is ultimately affecting the health in early age. So, to prevent ourselves from the pandemic situation, immunity plays a very important role. Always keep this in mind. Prevention is better than cure. For any event to get successful, teamwork is very essential. Even if one of the team member doesn't work properly, the result of the work is not that much fruitful. Same is with immunity system. What is immunity? In my words, Im means immense and unity is to bring together or to be combined. So if all the vitamins, proteins and nutrients which supply our body, they are in proper way or their supply is proper to our body, then the body can overcome all the health issues and can protect against poisonous organism. So immense unity amongst those substance or the nutrients is mandatory. Now here, what are the primary requirements of health? Body consists of fibrous or lymphoid connective tissue from which the supporting tissues such as bone and cartilage, highly specialized muscles, nervous tissue and skin develop. For perfect body health, one must have efficient circulatory and respiratory systems, healthy bone and joint structures, strong but supple soft tissue, perfect control and central and peripheral nervous system. All the major systems and structures of the body are functionally closely interrelated, and failure on the part of one may have far-reaching effects. Now, immunity, it is the state of being resistant to injury, particularly by poisonous foreign proteins and invading parasites. How to overcome it? How to improve our immunity? It is by doing exercises. And what are exercises? Physiotherapy itself teaches us about the exercises and to improve immunity. In exercises, there are active exercises, passive exercises, yoga therapy. So active exercises, they will strengthen the muscles. Passive exercises will rehabilitate and make the subject independent, and yoga gives relaxation to the mind. And also high protein diet, and we should also maintain good hygiene. So hence, in my words, what I have uh, uh, seen or I have experienced, immunity depends on 6 P's factors. First is patience. Patience is very much required. Now, if you approach to a physiotherapist and the physiotherapist, he prescribes you some exercises or teaches you some exercises, and if you expect the relief immediately, then this is not true. You have to wait for 3 days to get good results. So patience is very much required. Physical exercises, why physical exercises are required? To increase the blood circulation and proliferation, to increase RBCs and WBCs, and then the proper flow of blood, the proper flow of synovial fluid make you mobile. Then the third point is peace of mind. What is peace of mind? You should always be in relaxed position. There should be no tension, and you should always think positive. So fourth point is positivity. If somebody told you, "Arey, due to this coronavirus, everything is going to be finished," and then you become panic, and this ultimately affects your health. So positivity, think positive. Yes, is it like that? So we will try, we will fight against that. We will do exercises, we will improve our immunity, and we will overcome all this pandemic situation. So positivity should always be there. Then proper hygiene. You have to maintain proper hygiene. That is, you have to wash the hands, you have to take care of yourself and your family members, elderly and younger people at your place and at your working place. You have to take care of them, and you maintain cleanliness. Dusting should be there, and disinfectant should be sprayed everywhere. So this is proper hygiene. And last is protein diet. So protein diet is very much required in the form of fruits, eggs, sprouted vegetables, and all the things. So these P's in your life, they plays very important role. Then again, it is said that health is wealth. If your health is good, then only you can work and earn money for the betterment of your family, and also you can improve your uh, academics or do good for your profession if your health is good. Now, there are many points that can be added in improving immunity. Then now I am going to share some slides so you will get the picture clear. Yes, here I have explained you what is immunity. The immune system protects human body from invading various types of foreign bodies like bacteria, virus, toxic substances which enter the body. Immunity, it is a state of protection from infectious disease, basically cops fighting against crime. I have shown that video. Then immunity is also called disease resistance. That is, lack of immunity is known as susceptibility. Types of immunity, there are two types, that is innate and adaptive. Innate immune system, that is, forms the first line of defense. The images are shown here. Please go through that. And here the response is non-specific. Exposure leads to immediate maximal response and no immunological memory. So here bacteria, viruses, and fungi are constantly invading. Sometimes some get around the barriers. They are like the garbage man and target anything for it. Cells signal to the adaptive immune system for help. Now, what is adaptive immune system? It forms the second line of defense. Pathogen and antigen specific response. Lag time exists between exposure and maximal response. Exposure leads to immunological memory. Now, when does the immunity breaks down? Sometimes the immune system makes a false identification of substances as danger when it's not supposed to be. When immune system reacts to fight these invaders, turns into allergic reaction. Body can't fight off every invader. There are various diseases that we have no control over, and when immune system is compromised, bacteria, viruses, toxin substances can overwhelm the body. Result, you get sick. Now, how to improve good immunity? Improvement follows hardship, that exercises are required. It's vital that your immune system is in good working order if you want to stay as protected possible. As age advances, every part of body tends to work less efficiently. It overall hampers body performance, eventually leading to bad health and bad quality of life. And person is more prone to develop diseases and comorbidities. There are several ways to boost a person's immunity, but many people follows easiest way to practice it. Usually plan to maintain balanced diet, including supplements, along with lifestyle modifications. To overcome health hazard and improve immunity, one has to maintain balanced diet, regular sleep, cessation of addiction, lifestyle modification, and regular exercise. Along with nutrition intake and lifestyle modification, body has to be imposed under physical demand to become powerful tool to overcome diseases leading disability. Together, if all the measures are carried, can lead to improving immunity and good health performance. If the measures are carried out selectively, then the response will be selective too. Now, to how to improve it? So you have to do exercises. What I have told you before, you have to think positive. There should be no addiction. Prevent yourself from addiction. There should be no stress and sound sleep for 6 to 8 hours and good diet. Now, like what is a healthy diet? Like any fighting force, the immune system army marches on its stomach. Healthy immune system need good regular nourishment. Scientists have long recognized that people who live in poverty and are malnourished are more vulnerable to infectious diseases. A rich diet with so much nutritions, these nutrients are primary factor to fight infection, and key component involved to protect immunity are vitamins A, C, E, B6, D, and minerals like zinc, iron, and selenium. The reason many vitamins help to maintain strong immunity because they are antioxidants. They help buffer the effect of free radicals, which are harmful chemicals that damage healthy cells, genetic material, giving viruses better shot at invading, destroying the immune system. Antioxidants work to counteract the effect of free radical by helping immune system to prevent, treat, suppress viral activity. Protein contains amount of zinc, which is a mineral that induces production of WBCs to fight infection. Now, here lifestyle modifications. Proper sleep is required. You should stay active, and cessation of addictions. Already we have described it in our slides, and avoid stress optimism. Now, sleep is one of the vital part of body to function efficiently. Can be carried out easily without making efforts for it. Body uses sleep as means of healing itself. Just like electronic gadgets, body needs sleep to charge itself. Irregular sleep will make body vulnerable to various illness and makes the person lethargic. Bad sleeping patterns can lead attention and memory problems, leads to various mental and physical illness. So we are in need of 6 to 8 hours of sleep. If proper sleep is not there, your whole working schedule is disturbed and you feel very lazy and you cannot do your work or you cannot study properly. Your concentration is also not proper. So try to take 6 to 8 hours of sleep daily. Good healthy sleeping pattern will lead to increased alertness, improve mental and physical health, and promotes happier and engaged life. Now, in day-to-day life, you establish your routine schedule, that is early to bed and early to rise. So you can get your 6 to 8 hours of sleep. Unplug blue lights disrupts your circadian rhythm, and these electronic keeps up late. So you have to off it. Avoid alcohol, heavy meals, caffeine before going to bed. Regular exercise have been proven to help sleeping patterns if they are performed 4 hours before bedtime. How many hours one should getting appropriate sleep? That is, it is 7 to 8 hours. Now, when a person struggles with addiction, they may experience several side effects from chronically ingesting these substances. Long-term abuse can considerably damage many systems in the body, especially immune system. Immune system may be harmed directly by intoxicating substances, or the way drug is ingested may contribute to higher risk of infection. This lowers the immune response. One suffering from addiction can harm various organs and functions, which play important role for our existence. Harm done to immune system can lead to serious recurring or incurable infection, and some of the infections may cause other long-term problems or lead to death also. How to overcome addictions for better health? Talk to closed one regarding the issue of for mental and emotional reinforcement. Consult physician, keep mind and yourself busy, replace addictions with recreational activities, believe in yourself, that is self-confidence is required, routine workouts, yoga, dance, meditations, eat healthy and maintain balanced diet to heal body. Now how mental health affects immune system. Mental disorders can also include physical signs and symptoms. There are various mental disorders, but most common of all is depression. Depression is friendly with all the age group people. Depression affects on a mind and body. One of the places where depression impact is the immune system. So whenever there is failure in any work, instead of thinking positively, we think in negative way, and then it affects our body, and then depression, we suffer from depression, and then it will take a long time to get it back to normal. So now, doctor, you are right. How to overcome this? Till now, we all got know how bad immune can mess with the body. So bad offices does bad security. To nurture these agents, one has to follow those pillars to attain good immunity. How to overcome depression? Analyze the cause. That is, what is the cause behind this depression? Consult doctor in chronic cases. Doctor in the sense, you can consult to the psychologist first for counseling, and then the psychologist can refer you to the psychiatrist if the problem is serious. Now talk to closed one, that is interaction, communication. The problems, you should share your problems with your close friends or the family members. Follow lifestyle modification, healthy diet, routine workout, learning new skills, making new hobbies. Try to be optimistic, socializing, and never give up on depression. So how exercise boosts immune system? Exercise activity requiring physical efforts carried out to sustain or improve health and fitness. There are varieties of exercises. Some people tend to go light exercises and some people for heavy exercises. Every day, a routine exercise of any intensity is essential for preventing wide range of diseases and other health issues. Now, it's been widely agreed that regular moderate intensity is beneficial for immunity. Studies say that short-term exercise can help immune system to find and deal with mediators. Long-term exercises slows down the changes that happen to the immune system with aging and therefore reduces the susceptibility of infection. Now here, exercises, they varies from younger to older generation. Younger people, elderly people, the exercises varies age to age. Now, vigorous exercises we cannot advise to everybody, and one should not go to do the exercises more than 40 to 45 minutes, and there should be light, gentle, soothing exercises that will increase the blood circulation and keep your mind relaxed. Instead of getting fatigue, or instead of making the muscles fatigue with doing hectic and exotic exercises, better to go for gentle exercises which will give a soothing effect to your body and mind. Now there are two broad category of exercises. First is aerobic exercise and another is anaerobic exercises. Aerobic exercise, it aims to improve how the body uses oxygen. It used to build up endurance, stamina, and it includes warm-up at 20-minute session and cool down. It improves. Benefits: improve muscle strength in heart and whole body, lowers the blood pressure, improves circulation, increases the red blood cell count to enhance oxygen transportation, then reduces the risk of diabetes, stroke, and cardiovascular diseases, that is CVD, improves the expectancy and symptoms for people with coronary artery diseases, stimulates bone growth, and reduces the risk of osteoporosis when at high intensity, improves sleep hygiene, enhances stamina by increasing the body's ability to store energy molecules such as fats and carbohydrates within muscles. Anaerobic exercises. This exercise does not use oxygen for energy, most commonly used to build strength, power, and muscle mass. So you have seen the bodybuilders and boxers, they go for anaerobic exercises. These exercises are high intensity activities that should last no longer than around 2 minutes. Anaerobic exercises include weightlifting, manual or mechanical training, interval training, isometrics, any rapid burst of intense activity, while all exercise benefits the heart and lungs. Anaerobic exercise provides fewer benefits for cardiovascular health than aerobic exercise and uses fewer calories. However, it is more effective for building muscle and improving strength compared to aerobic form. Increasing muscle mass causes the body to burn more fat even when resting. Now, which type is better to boost immunity system? Moderate intensity aerobic type of exercise are effective in ascending the immunity system. Comparing the effects of both exercises, it not only improves the blood circulation in the whole body, but also multiplies the RBCs and WBCs count and enhances oxygen transportation. It also enhances lymphatic drainage and blood flow to organs and the muscles. It enhances stamina by strengthening muscles of heart and lungs. Sustaining this kind of exercise will maintain the integrity of overall body function. Now here, what I want to add is, now there are many things you have to include in your diet. In the morning, if you drink warm water, then it is beneficial for your health. Again, laughter is the best medicine. So in the morning or in the evening, if you laugh loudly, ha 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 ha, the people who are surrounding you or in front of you, they will also give a little bit smile, and the other people surrounding you, they will also laugh. What it does, it vibrates all the body organs. And when the vibration is there, heat is produced. When heat is produced, then circulation is good. And when circulation is good, synovial fluid flow is also good. Why you require synovial fluid flow? For the mobility of the joints. If the flow of fluid is very good, then your joints also work nicely, or otherwise there is pain in all the joints. Nowadays, many of the candidates, they are doing work from home. So sitting position is required for a longer time. 4 or 5 years continuously they are sitting. So what they are experiencing? Joint pain, that is knee joint pain, shoulder pain, elbow pain, fingers are also painful. So for this, the movements of the joints, movements of each joint, that is shoulder, knee, it is mandatory. So after 2 hourly, you can do little bit gentle exercises and to keep yourself active. So you will not be a sufferer. And see, for any difficulties or any problem, there is a solution. Physiotherapy exercises gives you all types of vitamins, because when you exercise, it is produced, proliferation is there, blood circulation is there. So if the exercises are given to lungs, all the organs of the body. When you jog or when you walk, gentle walking or brisk walking, if you ask the subject to do all these things, then you can prevent yourself from further damage of the body. So think positive. You have all the guts. Your physiotherapy is there. Exercises are there to prevent you from all the poisonous viruses. So take healthy food, maintain your routine very nicely, and do exercises. Diaphragmatic breathing is required to keep your lungs strengthened. So if you want to keep fit and fine, you have to do exercises. So stay healthy, stay home, save lives, and thank you very much for taking part in this webinar. And I thank you all the participants and the team members to have done this very excellent and good work. Thank you. Namaskar.
Thank you so much, ma'am, for this excellent presentation. These are not the points to only follow during this pandemic, but also afterwards. So that's going to be very helpful for us. Thank you again, Dr. Barry Getz and Dr. Sucheta Golhar, ma'am, for this wonderful presentation and lecture and educating all of us. For all the participants, I know there have been many questions coming and about immunity as well. So all the questions that were not included in the presentation or covered will be answered in the WhatsApp group that you are added in. So please do not leave that group yet. Also, you'll be given feedback forms. So please kindly fill all of those and let us know how it did and give us a good feedback, I hope. So now I would like Prashmeet to please give the vote of thanks.
Good afternoon all. Thank you all participants for joining this session. I thank our speakers of session, Dr. Barry sir and Dr. Sucheta ma'am, for such an informative session. On behalf of all the participants, I thank Barry sir. I thank Barry sir for making us understand the importance of private physiotherapy practice and clear concepts on COVID-19. And heartily thanks Dr. Barry sir for clearing our ideas on scope of physiotherapy in future. Now I thank Dr. Sucheta ma'am for clearing everyone's ground concepts about immunity and making aware of why immunity is important in our daily life. I also appreciate ma'am for letting us know about the techniques to improve immunity. And at the end, I would like to thank our streaming partner, PhysioPanda, for providing us such a great platform for streaming. Now, finally, I thank Dr. Arslan Badgujar, Ms. Arslan Ishuklo, Ms. Geet Gogari, Mr. Rajiv Gavi, Mr. Wasim Sheikh for very outstanding support. This session was not possible without a precious cooperation of amazing colleagues. Thank you so much Be safe, keep moving. Now I finally declare the session. Thank you so much. Of amazing colleagues. Thank you so much. Be safe, keep moving. Now I finally declare the session. Thank you so much.